Today, we are honored to welcome Dr. Carl Rothschild to the show today. I'm very excited about this episode. He talks about an extremely important topic. It's all about photobiomodulation, or red light therapy. Now, red light therapy has so many different benefits in our life, right? And getting the expertise on there to actually incorporate it in our life is so important. So we're very honored to have him on the show today. How you doing, man?
I'm doing great. Thank you so much for having me on the show. I love having the opportunity to share what I think is a very important subject, and that if allowed to happen, it could be absolutely revolutionary in the world of well-being and health.
Definitely. I'm very interested to hear your story and how you got into health and wellness and red light therapy and what you're doing to help people today.
So believe it or not, it started in 1972. And there I was, a junior at Stony Brook University, which is a very good school out in New York. And I was a science nut. I mean, I loved biology. I did things in my basement at home, that research and all kinds of stuff that with every kind of organism you could think of. My big thrill was getting a microscope. But at any rate, but in 1972, there I am, a junior. I couldn't really see how that was going to translate into career. And then someone introduced me to chiropractic. Now, I want to tell you that in 1972, and many years even after that, chiropractic was looked upon about three notches below voodoo. In other words, it wasn't well thought of. It was frowned upon. But you know what? I did my research. I called chiropractors all over the country, and everyone I called, every one of them loved what they were doing, and that's what I wanted. I was my own version of a hippie. What that meant to me, most importantly, is that I wasn't going to let money direct what I was going to do. Just if all I did was make money, that wouldn't be great for me. I like the opportunity to help people and to be creative and to have fun. And after interviewing all these chiropractors, I realized that that might be a good opportunity. So I drove all the ways from New York out to California, where at that time that was the best chiropractic school in the world, actually. And in 1978, I got my license, and I started. I opened up my practice, and it was wonderful. I mean, I had a lot of fun with it. I was able to help a lot of people with all the different techniques that I learned over my years, diet, nutrition, all kinds of stuff. And then about 20 years into my practice, a medical doctor out of USC out here in California introduced me to red light therapy. So he was the first one, and I joined his team, but he was the first one to get FDA clearance on red light therapy. This was, again, about 28 years ago. And man, I brought it into my practice. Now, of course, I thought he was nuts. He's handing me what looks like a flashlight, and he says, "Shine this on your patients and help me save the world." And I thought he was crazy. And it turns out that it revolutionized my practice. I was able to heal things I never believed possible in the past. I just would go to my patients and say, "I've got introduced to this new thing." And the only thing they know for sure is that it couldn't hurt. In fact, in the 50 years they've studied this technology, there has never been a recorded side effect. You couldn't hurt somebody with this stuff if you tried. And so I went to my patient and said, "What do you got?" So don't hold back, because with chiropractic they might not tell you about kidney problems or all kinds of issues. So this lady said she had gum disease, and I helped her. And this guy said he had kidney problems. I helped him. And it just went on and on with all kinds of ailments and issues, especially in the musculoskeletal world. So any muscle, tendon, ligament, bone, joint, anything like that, we had really great results with that. And then about, let's say 15 something years ago, it was discovered by accident that there was an element of light that actually helped with weight loss. And you and I both know that weight loss is huge in this country. And if you can go to somebody and say, "I have a way that you can lose weight that is safe." You're not freezing the fat. You're not boiling the fat. You're not lasering the fat. You're not using ultrasonic cavitation or radio frequency, which all of those are about exploding fat cells, about destroying fat cells. Well, the technology that I'm going to introduce to you doesn't do that. What it does, and what they learned, and this took years after they discovered it, more recently, they discovered that the certain element of light, and it's red light only. It's not any other color. It's not any infrared. It's red, red only. That certain elements of red will actually help to change the fat cell wall temporarily. It only lasts a couple hours or so, to actually have the fat cell wall become more porous and allow some of the fat contents to leak out into the surrounding tissue. And then with our unique protocol, we move that fat away from the fat cells and eventually to the liver for use or elimination. And it works. The downside is that we're going to rely on a person's body to help. So in other words, if somebody has horrible circulation and their ankles are swollen and their joints are all swollen, then they're not going to be able to help us move that fat away from the fat cells as easily. So in their case, it'll take longer. But in that case, what I tell people is that sometimes, instead of concentrating on losing fat, maybe we should concentrate on getting you healthier first. And so some people have to get healthier before they can lose the fat. That's why some people can work so hard on their diet and everything and still not, they plateaued out and they can't lose any more weight. It might be because they have poor circulation or some other ailment or issue, a hormonal issue or something like that that gets in the way. Well, when I learned that red light could actually help with fat loss, that's when I said, okay, you know, I'm going to take this a whole nother level. And I started manufacturing equipment. And of course, I wanted to have the best. So we were manufacturing, we were involved with lasers, we were involved with pads, we were involved with pedals and all that sort of stuff. And it was fun. I mean, we had really nice local results, fat loss and some, you know, an elbow problem, a shoulder problem, a knee problem, that kind of thing. And then about whatever number of years ago when COVID first hit, our practitioners came to us and said, it'd really be nice if you could come up with a way that we could treat the patient with less physical contact between us and them. And we came up with a bed. Because with the bed that we came up with, the person can get in and out of bed themselves. So they just walk into the office at the time that they say, okay, Judy, go into room 3. That's where your bed the bed is. They get in the bed, they get out of the bed. They wave goodbye as they walk out because they've already paid in advance and scheduled in advance. And it's as easy as can be. There are no moving parts that you have to worry about. And so when people ask me, well, how much does it cost to get one of these beds? I say, let's start off with the notion that you don't need staff or extra staff. So, you know, you're saving money right off the table, right off the top. And so we started delivering our first series of beds several years ago. And the feedback we started getting was incredible. I want to give you an example. A guy named is Arnett. Now, Arnett was having heart attacks. He started having heart issues 20 years ago. And so he started having what's called congestive heart failure. His heart wasn't functioning as well. Until about 5 years later, he started having heart attacks. So in other words, 15 years ago, he started having regular heart attacks. They started out once a month, twice a month. Well, by the time we meet him, he was having them as often as twice a week. And every time he died, the defibrillator that they had implanted in his chest would zap him back to life. And he was dying. By the time we met him, as I said, it was twice a week. Every organ, every gland, every tissue, he had no energy. Everything was failing on him. And the practitioner calls me up and says, this guy's coming in tomorrow. I don't even know if I should treat him. And I said, look, we know that this technology, in the 50 years it's been studied, there's never been a recorded side effect. Again, you couldn't hurt anybody if you tried. And as a matter of fact, there really aren't any serious contraindications. A contraindication means who should or should not get in the bed. Well, should somebody with a pacemaker, is that contraindicated? Somebody with a defibrillator, is that contraindicated? And the answer is no. This is a light, as safe as can be. There's only an upside, no downside, and the worst that will happen with anybody is nothing. So getting back to contraindications, the only contraindication is pregnant women, and I'll tell you why I say that. We know that the lights would help the mother and the fetus, but if that baby is destined to come out abnormal, having nothing to do with our lights, nothing to do with anything that I know of, and that baby comes out abnormal, they're going to want to blame anybody in that neighborhood. So I tell people, you know, let's not treat pregnant women until after they deliver their baby. And then you can treat the heck out of them. In fact, they're going to love it because it'll help with the baby fat that they just collected. And it'll also help with, especially with a C-section, they'll recover from that surgery faster than they ever could imagine. So at any rate, there we are with Arnett, and he gets that one treatment. Now, normally a treatment is 12 minutes. We only treat him for 5 minutes. And he goes home that night, and that was about 2 years ago. He's never had a heart attack since. He's had more treatment, but no more heart attacks. Hundreds of heart attacks, no more heart attacks. And everything has come back to life. His energy is through the roof, as he describes it. And so I'm going to be sending you a series of videos that I'd love for you and your audience to watch. And don't take my word for it. In fact, I don't want you to take my word for it. There's another thing I'm going to provide for you so you don't have to take my word for it. Because I wouldn't believe it. When I tell you some of these stories, they're unbelievable. And I didn't expect, when I got on the Zoom with Arnett, who had the heart attack, I had no idea what to expect until he started talking. And it's gorgeous. It's so wonderful. And me wanting to help people starting in 1972. Not money my focus, helping people. And now we're hearing something that we heard a little bit, but now we're hearing it more than ever. And it goes like this. Thank you for giving me my life back. And we're getting that so many times from so many people. And so not only did I talk to you about Arnett and the amazing results with that, but also other people like Jessica, who had, when I called her, I thought she only had one issue. That was Lyme disease. When I called her and we started doing the Zoom, and she started telling me all the things that were going on with her, it turns out that I counted about 16 things that were killing her, that were driving her nuts, but also physically destroying her body, including Lyme disease. She had uveitis, which means that in one of her eyes, the pressure on the eye normally is around 10, and hers was over 180. So if that goes untreated, that will guarantee her blindness in that eye. So the treatment, medically wise, is drops in her eyes, which is $400 a month copay, and injections right into her eye, which is billed to the insurance at $5,000. And like a nut, I said, what's that like, having an injection in your eye? And I'm glad I asked it, but it's kind of obvious that no one's going to sit there and go, yeah, that was a thrill. So I want you guys to watch this and learn that in a very short period of time, using our bed, her eye pressure went to normal. As all 16 things went to normal, including 20 years of diarrhea, Lyme disease, shingles. I talked about uveitis. We talked about 3 forms of psoriasis, including guttate psoriasis, plaque psoriasis, and psoriatic arthritis. With the psoriatic arthritis, she had dactylitis, which if you look it up, it means that in the morning she would wake up and frequently her toes would be swollen, black and blue, and very painful. And after 2 visits, that stopped. I'm just telling you what she's saying. I don't consider this me making claims. I'm just reporting the news. I'm just telling you that this is news, and it's newsworthy. So anyhow, that patient, by the way, that I told you that was having a heart attack, he only treated for 5 minutes. Again, normally a dose is 12 minutes. And I challenge all of you to get 6 treatments if you have an issue. If you're perfect, I don't know if you're going to see a difference. But if you have issues, I want you to get in this bed. And I'm not in practice, so I'm not inviting you to my office. But we have hundreds of offices all over the country. And all you have to do is go to the website. And the website is trifectalight.com. We're going to send it to you in the show notes, and I'll repeat it in a little while. But when you go to trifectalight.com and go to the Contact Us page, on the left side of that page, of the Contact Us page, you can put in there information to find a location closest to you. And then I want you to go to an office, if we can find something close enough to you, for 6 visits. That's 3 times a week for 2 weeks. That's all it takes, 6 visits to see a difference. Now, you may need more visits than that, but you will see a change in 6 visits like you hadn't seen before in many years. Like Joey, who had Charcot-Marie-Tooth disease, which is a weird name for an autoimmune disease, which guaranteed him 15 years of pain daily, and 15 years of him not really being able to walk. And after 6 visits, they get an interview. So I want you to watch Joey's video. In fact, watch all of them you can. And you'll see how Joey was the first one within that first month of us delivering the beds that came up with, "Thank you for giving me my life back." So I want to point out what's significant here is that not only is red light therapy amazing, and I'm going to go over, we talked about how it worked from the weight loss point of view, but I'm going to talk to you about how it works from the healing aspect in just a moment. But I want to point out to you that as I said, in 50 years of studying this stuff, there's never been a recorded side effect. But what we learned is that when you bathe the whole body at the same time, that's when you see the difference. Before, we were doing pads and lasers and things like that. But when you bathe the whole body, top to bottom, front and back, left and right, inside and out, that's when you're seeing these miraculous changes. We didn't see that before. We saw nice things. The shoulder felt better, the elbow felt better. But now we're seeing things that are unbelievable. So I'm talking about Parkinson's, dementia, Alzheimer's, multiple sclerosis. I already talked about autoimmune disease, kidney issues, diabetes, heart issues that we already described, Lyme disease that we talked about, any skin condition. I don't care what skin condition you have, whether it's psoriasis, as I mentioned, or eczema, whether it's severe acne, doesn't matter. You got to try this bed. Just give it 6 visits. And at the end of the 6 visits, you have a sit down with the provider and go over what effect this had in those 6 visits. Again, that's 3 times a week for 2 weeks, 6 visits, 12 minutes a dose, and see if you don't see some kind of change. So even with severe Parkinson's, we're noticing from a tremors point of view, we had this one lady that her big handicap, even though she had many conditions, but the thing that irked her the most, bothered her the most, was the tremors. Because she couldn't hold the Bible when she went to church. Her tremors were that severe. And after just a couple of visits, the tremors, they're still there, but they became so much more mild that she was easily able to hold the Bible. And then we had, getting back to Parkinson's, staying with Parkinson's for a minute, we had another lady that had severe Parkinson's, but she also had severe dementia. So they could not handle her really at home. You know, she was becoming belligerent and very difficult and a danger to herself and others. And they figured, well, let's try this red light therapy as a last chance. And this was early on in my career with full-length, full-body treatments. I didn't know. We didn't know if it could help. And getting her into the bed, if you know anything about Parkinson's, they're like a stone. They're so stiff. Like getting her into the bed was very difficult, but getting her out was much easier, just after 1 visit. And then after 2 weeks, everything calmed down, and within that first month, she became lucid. So before that, they could barely communicate with her. And now she doesn't have to be put in a home. And now she's good. I mean, she's an elderly lady, so she's not going to go run a marathon. But it's not about curing people only. It's about getting a higher quality of life. That's what we're looking for everybody. In some cases, it can be fully resolved. But in many of these chronic, severe cases, at least we're going to see an improvement like they haven't seen in many years in their life. Even from a psychological point of view, believe it or not, this will help with mental issues. So we had this one lady who hated her life. She was so depressed, and she literally hated her life. And after 2 weeks of treatment, she wrote me a note soon after the second week of treatment. And it goes something like this: if this is how normal people feel every day, I can't believe I've been missing out all this time, because she found something that she had been missing for a long time, and it's called joy. She had not experienced joy in many years, and now she's experiencing it. She still has the ups and downs of life, but she's able to handle them better and not be so overly sensitive so that her depression doesn't take over. So I just want to mention a couple of other things, and then I want to go over the mechanism of how this whole thing works. So first of all, I wrote a book. I don't make a dime off of this book, but if you want to learn more about red light therapy, It's called Illuminated Healing. In fact, we'll send that to you as well. So you can share that with your audience, and the show notes, which will have the videos, it'll have the Illuminated Healing also included. But when you go to the website, trifectalight.com, go to the Contact Us page. On the left side is about finding a location. On the right side is the possibility that you might think that this would be a wise investment to have in your business or in your home. If some people will think about it being expensive, it's about $1,400 a month to lease. So from a home point of view, these are people who have more money than health. And they recognize that, when people say something's expensive in the world of health, but it's something like this bed that will prevent them from getting really, truly sick, perhaps, and give them what we call it the fountain of youth, actually, but giving them a higher quality of life. And the reason why people might not recognize the value is because they have no clue how much it costs to be sick. If you've never been hospitalized, if you've never had to take these crazy drugs out there, and you don't recognize, let me give you an example. There's these drugs now, the newest, are called biologics. So they are actually given as an IV, just like a chemotherapy drip. These are given as an IV drip. And one dose can be billed to the insurance for $55,000. One single dose. It's a 1-hour drip. So get an idea how expensive this stuff can be. So getting back to the website, on the right side of the Contact Us page are for people that might be interested in finding out if this makes sense to either bring into your home, or 95% of people who buy these beds are more for business. It acts like a magnet and will bring more business to your location than you can imagine. I was just on the phone with this lady who loves the bed. She's not buying it. She goes to a business near her, and she told me that she referred 18 people to that location. And that's not uncommon. 18 may be a little high, but we see and hear people referring a lot of business to their local facility that they're going to, because I want to remind you that it's not satisfied patients that refer. It's excited people. And you're never going to see more excited people in your life. Now, I'm also going to tell you that I recommend that you go to our YouTube channel, and we'll send that to you as well. If you went to YouTube and put in the @ sign and then Trifecta Light Official, you're going to see all these great, I think it's 150 videos now, and they're wonderful. So now let's talk about the mechanism, how this works, and then I can answer any of your questions. We talked about how fat loss works, and that was more recently discovered. But they've been studying the healing aspect of light therapy for many years. And what we learned is that certain elements of light will actually stimulate the cells of your body to come back to life. If you've ever heard of the word mitochondria, what they learned was that the mitochondria is the powerhouse. We've known this for many years, that the mitochondria are the powerhouse of the body. The mitochondria is the reason why we breathe oxygen and eat food, to create this very important molecule called ATP. And the ATP is the energy currency of the body. And that if you have the right amount of ATP, you're good. You can heal from almost anything, and you can avoid getting sick from many other things. But the more important thing is, if you don't have the right amount of ATP, less than you should have, that will definitely lead to disease and eventually death. So this whole light process is about stimulating the mitochondria to come back to health. And what we discovered, that there are elements of sunlight, red light in particular, and near infrared also. We combine those two elements, drive them deep into a person's body with lights that cover you from head to toe, front and back, left and right, inside and out, affecting as many of the cells of the body. Now, one thing that most people don't realize, when I went to school, we were taught that there was one mitochondria in every cell of your body, and that turns out not to be true. So the heart, which has the highest demand for energy in the body, has over 5,000 mitochondria in each one of its cells. The other tissues in your body also require typically much more than one mitochondria. So now I'm going to tell you something that is a little outrageous, but it is true, that the mitochondria make up 10% of your body weight. I'm going to let that sink in for a second. You got bone, you got skin, you got blood, you got all the tissues of your body, and yet and still the mitochondria make up 10% of your body weight. That's how important it is, that's how prevalent it is, and that's how critical they are. And what we've done is by manufacturing and creating these very strong lights that we drive deep into the person's body and affecting as many cells as we can, is why we get these kind of spectacular results. So, with that said, do you have any questions for me?
Yeah, thank you for sharing that, man. That was excellent. So it sounded like you got into the whole wellness place through chiropractic care. Then you got introduced to red light and saw these amazing healing benefits, right?
Yeah, I'm not. And when we deal with a professional, whether it's an acupuncturist, chiropractor, naturopath, or whatever, we're not saying do this instead. We're saying incorporate it into your practice. It will become a centerpiece because people are going to be knocking down the door trying to get into the bed, but still have that along with your chiropractic, along with your naturopathy, or whatever else you're doing.
Absolutely. What I like that you mentioned is that instead of focusing on weight loss, focus on getting healthy, right? Because if you pursue health first, the weight loss will come. And many people, they get into the weight loss and they do unhealthy things to get there so it doesn't last.
Yeah, so all these injections that people are taking now, which I'm not going to mention. I don't want to get myself in more trouble than I already am. But I can tell you that what they don't do and they haven't done is enough exploration as to what are the unhealthy side effects that come from taking these drugs. And one thing that they're seeing increase by thousands of percentage are how it's screwing up your pancreas and your liver, particularly the pancreas. And remember, these drugs are for diabetics who otherwise would die. So these drugs were originally to help diabetics. And it just as a side effect, they noticed, wait a minute, they're also losing weight with this. So they started using it much more readily, and it's all over the place. So I just want people to use caution. As a chiropractor, I don't put anything in my body that is not natural. I don't take injections, and I mean none, no pills, no nothing. I'm 73 years old, and I recognize that smart exercise, smart eating, avoiding certain drinking, never smoked, and taking care of myself was very important. I'll tell you something. You know why people don't take care of themselves in some cases? It's because they're not scared enough. Oh, if you're not scared of what the future could be, that could sometimes be why you don't take great care of yourself when you're younger. But I had the good and bad news about seeing a lot of people coming to my office, and I'd see some of them where I would say it to myself. I wouldn't say it out loud, but I'd say, please, God, don't let me wind up like that. So I go out of my way because I am scared. I don't want to wind up, an invalid. I liken well-being to a candle that burns really bright from the top all the way down to the bottom and then sputters out and dies. That's how we should go. But that's not how frequently most people, the last 10 or 20 years of their life ain't so great. They're invalids. In some cases, they can't feed themselves. They can't wash themselves. They can't even wipe themselves. And believe me, that's not what I wanted in my life. And I recommend the same thing for you. You don't have to succumb to, letting yourself go to such an extent that you're not going to have a great elderly life, senior citizen life. I used to teach a class, will you be dancing when you're 75? And I had to stop teaching it because I couldn't find a lot of people that believed that they would still be dancing when they're 75. But they should be. At any rate, any other good questions for me?
Yeah, so I really like that point they made there because a lot of us were kind of focused in on day-to-day actions. We don't necessarily see the long-term consequences, right? So we're just kind of doing what we've always done. But until we develop this awareness and actually take control of our health, then we're just going to kind of live in this subpar state of being, in a sense.
Correct.
Yeah. And you also mentioned sort of the difference between health span and lifespan, right? Because we're living these old ages nowadays, but we're not living longer, we're dying longer. We have these years or decades of just misery, and it doesn't have to be like that, as you mentioned.
I like that. I'm gonna steal that one. Dying earlier. No. What did you say? Living. We're not
We're
living
not
earlier.
living longer, we're dying longer.
Dying longer. I'm gonna remember. I gotta write that down. All
Yeah,
right.
man. So, in terms of the science, I know there's so many different scientific studies nowadays for red light therapy. You want to get into that a little bit?
Well, first of all, I'd love for you to go to Google Scholar, and it's scholar.google.com, and we'll put that in the show notes as well. And when you go there, you put in the word photobiomodulation, which I'll also send out to you. And when the person goes to the Google Scholar, puts in the word photobiomodulation, and press enter, they will see thousands of studies, double-blind studies, research papers, articles, all kinds of stuff related to photobiomodulation or red light therapy. Then, if they filter that down so they can put in the next word lupus, so they can put in the next word whatever their ailment is to see what the controversy is, what the success has been. And the only controversy is you got to understand that in this country, what healthy people don't make anybody any money in the medical world. If you're healthy, if everybody was healthy, the medical profession would go broke. They would. They're there for the sickies. And so their focus is on waiting until you're half dead, and then there's a lot more money to be made there. Well, I'm trying to get you to focus on maintenance and prevention and getting yourself in really great shape and staying that way. Sometimes the first part is easier than the second. So in other words, getting healthy is not as difficult as staying healthy. Because when someone's in pain, when someone has issues, they're highly motivated to do something. Now we get somebody that has no pain, they're doing great, they think, and they're not as motivated. And that's when they really should take good care of themselves, even more so. It's much easier to stay well than it is to try to get well. If you allow yourself to get ill, you allow organs and glands of your body to suffer, to reverse that is not easy.
Yeah, that's a great point as well because, as you said, like when we're sick and we actually see a path forward, we're just kind of on fire to make that change. But then some people they get healthy, but then they have a hard time keeping up on the practices that keep them there. So that's really important as well to actually have a strong why. Like, why are we actually doing this? Like, it's to invest in our future in a sense. Because if we stay healthy now and we actually take on those practices and actually make it part of who we are, then we're going to actually have a long, healthy life and actually be fulfilled in the process.
So one of the things that's really important that I want to review with you is, so, we were one of the first ones to really develop high-end lights. And they make a big difference. But you know that there's a country out there that professionally exists to knock off any of our equipment, any of our stuff. So China has come out with all kinds of junk that people might think are equivalent to a high-grade medical device. So here's what you should be looking for. You should be looking for high-end medical lights that don't get hot. Heat is the enemy. In other words, think about this. When a person gets hot, they get flush, more blood comes to the surface, they're red on the outside, and that would block the penetration of the light. That's not what we want. We want cool burning lights. That's why back 28 years ago we called it cold therapy or cold laser. They weren't literally cold, they just didn't get hot. And now a lot of the lights that are out there are junk and they get hot. And the problem with red light therapy is sort of a problem. It's even junk works to a degree. So people will not recognize perhaps that what they're getting is junk. So if you can't afford the highest level of devices, then go to a facility that has it. You might not be able to afford to buy an MRI for yourself, so you go to an MRI center to have it done. And that's the same thing here. These lights are the highest grade lights. That's where the money is. That's why our beds are more expensive than the crap that's on Amazon. The other thing is that you want that full body coverage, as I said. I don't have an objection to masks and helmets and all that, but if you want the full body experience to get the kind of miracles that I'm talking about, not just get rid of this pimple that's on your face here, but truly heal the whole body or take care of the whole body, you want a full body coverage bed, top to bottom. Then you want that top canopy to be able to come right down onto your body. If you have spacing between your body and the lights, you're going to wind up in trouble. Because the further you are away from the lights, the further your body's away from the lights, you lose power exponentially. So that's not going to work. And then the other thing is that you want to be able to customize the treatment. So someone who's, for example, 80 pounds doesn't get the same dose of someone who's 400 pounds. Because the 400 pounder has a lot of flesh and you can throw a lot of energy into that body and it won't get hot. Now the 80 pounder has basically no flesh, so we have to tone down the power so we don't get heat. And the next thing is that you want the capability of being able to pulse the wave. Because pulsations, some of you people might have heard of energetic healing, frequency healing, light frequencies, things like that. So we have the capability of pulsing the wave at the same time, which enhances the results and success that we have. And I think the last thing I want to mention is that when you want to get equipment for your business, you want to make sure that these lights plug into a high-end outlet, not just a common household outlet that you have, which is a 110. You want a higher grade light to really be able to handle the kind of energy that emanates from our bed. We have one of the only medical grade lights, and the next other medical grade light that doesn't work nearly as well as us costs twice as much. So, I don't want you to be looking for cheap, but I want you to look for wise decisions. So go to the website. On the left side of the Contact Us page is to find a location closest to you. And on the right side of that page is to find out if it makes sense, maybe, for you to buy something like this for your business. If you're in a business that's in the health industry, I'm talking about the health industry, the fitness industry, the beauty industry, because fine lines and wrinkles and skin are going to look great. Weight loss industry, and of course then athletes. The reason why we're with the NBA and Olympic training centers and other athletic facilities is because our athletes do so much better. If they get in the bed before their activity, they're going to perform better. And then if they get in the bed afterwards again, they're going to recover much quicker. So at any rate, you want to get a bed that you plug into a unique outlet called a 220 volt. So it has a dedicated line so you can get all that energy that you want to get into the person's body.
Absolutely. Another thing I wanted to mention back, you mentioned how most people, when we're healthy, we don't actually make the doctors any money, right? So that's kind of a backward system that we're in. Because I remember I was going to mention China, but in ancient times, they used to get paid when they were healthy. Right. So it's kind of reversed nowadays. So it's kind of strange how that works, but I feel like things are changing in a good direction. Also, something to kind of paint a picture for people in terms of the importance of red light. The sun is made of about 40% infrared light. So that's extremely valuable in that sense because that's the number one spectrum of light in the sun. Do I have that correct?
I don't remember if it was exactly 40%, but while we're talking about infrared, I do want to mention that there are more than one type of infrared. So in fact, there's no such thing as just infrared. So it's either far infrared, which is a fancy way of getting heat, or near infrared, which is what I told you before is cold, doesn't get hot. Near infrared is what we use, and only near infrared, because that's the healing element that combined with our red that helps with fat loss and healing at the same time. So we've integrated red and near infrared into our beds. We don't use far infrared. I don't have an objection to far infrared on other times, but when you're using our bed, we don't want heat, which far infrared is all about. So I did want to point out that there's a difference between some different types of infrared. There's actually even a mid-infrared, but we don't really talk. It has no therapeutic help at all.
That's good to mention because the near infrared, that's what actually gets into the body and into the joints and all those. Is that right?
Yes.
Yeah. Well, the far infrared, it kind of stays up in the atmosphere and kind of heats everything up. It's good for saunas, like for the heat. But, in terms of the red light therapy, yeah, definitely need the infrared, near infrared.
Near infrared. Near infrared and red.
Yeah.
Red has some healing qualities, but it's also the only thing that affects the fat cells the way I described.
The red
Red,
light, that's more like surface for the skin and things like that, right?
you mean as far as depth of penetration?
Yeah.
It has more depth of penetration than people think. When they first were studying this, they would actually look and see how much they think the depth of penetration was. But the truth is, it goes way beyond the visible. And but certainly near infrared is much deeper penetrating. But that's not the only reason why they use one type of energy or the other. There are other reasons. And these these wavelengths, they're like tuning into a radio station. You want to get the right station. A 1070 radio station doesn't mean it's more powerful than a 640. It just means that that's how we tune into that station. So we're tuning into the right wavelengths that will affect fat in one way, and then with all the healing in another way.
Absolutely. So, when it comes to selecting a device, are there certain things that people should watch out for in terms of the nanometers of light? Or also, are you concerned with electromagnetic frequencies? Like, are some like emitting high amounts of EMFs, and is that something to look out for in your opinion?
Yeah, EMF is very important. So let's talk about two different things. One is frequency, and one is wavelength. When I'm talking about wavelengths, we're talking about nanometers. We're talking about red in the 600 nanometer range, between 6 and 700 nanometer range. We're talking about near infrared, which is in the 800s and 900 nanometer range, that have been shown to be very healing. That's nanometers. Then I told you that our bed also has the capability of modifying the frequency so we can resonate with different tissues of the person's body. Now, as far as EMF is concerned, and this is a very important point, our first bed had very high EMF. And we didn't realize that in the beginning. And that's why we moved right on to we've had 9 modifications on our bed. One of the critical things was to lower the EMF to negligible. So our bed now has negligible amount of, it's called high frequency EMF. This high frequency EMF is why you want to stay away from, for example, living near these electrical towers that have been found that people around them, certain distance, have a higher propensity towards getting cancer. Whether it's true or not, they've done the research. It freaks everybody out enough that we wanted to make sure that our bed didn't have high amounts of EMF. And we were successful in that.
Awesome. And in terms of the power of the device, because in terms of a typical treatment, there are certain ones that have you being there for like an hour, which no one really has time for, right? So I feel like you've done a good job at that. You want to talk about the length of time in terms of treatment and how that should go?
Yeah, our dose is 12 minutes, number one. Number two, I don't know why anybody would have a device that's an hour, so I'd have to look into that. But I do know that there are devices that are half an hour. Power is not the most important thing. So you can have a very powerful bed, but if it gets hot, that's a mistake. You want a bed that's strong like ours, but doesn't get hot. So there are beds, even 28 years ago when we started with this, we could have had the most powerful piece of equipment possible, but we would have killed everybody because the lights would get so hot. Over the years, we've been successfully, with the research and everything that we've done, we've been able to create stronger and stronger lights, but keep the heat down to a minimum. And that's always been our goal, and it's always been our intention. But some people go, well, our bed is this and this power. Yeah, but it's hotter than heck because you don't know what you're doing. You're using power as a guide. It's not power, it's effectiveness. And effectiveness means a lot of power without heat.
Absolutely. All right, Dr. Rothschild, this has been awesome. We talked about a lot of great things in this interview. Is there anything you would like to add, or have we covered it?
I think I've covered everything. I'm going to send you a lot of these videos. I strongly recommend you watch the videos, and let me tell you, they're on Excel spreadsheets. So I want to describe something to you. There's a border around an Excel, around these spreadsheets. And the border will allow you to have more than one page within a spreadsheet. So I just want you to see that when you look at the bottom of the border of what I'm going to be sending you, page 1 says patients, page 2 says practitioners. So you might want to look at some of the if you're thinking of getting this for your business, to see and hear these people talking about the amazing results they're having using this light, of building their business and helping more people than they ever thought possible, and making more money than they thought possible. It's a great thing to listen to and watch that as well.
Awesome. Yeah,
So,
these devices are so powerful and such a valuable tool in your wellness toolkit, especially if you're in somewhere where it's not getting a lot of sunlight, you don't have access to that. Like these tools are so valuable and they help for so many things, as Dr. Carl has mentioned throughout this episode. So again, man, I appreciate you so much for coming on and sharing all your insights and knowledge with us. It's been real special.
all right, it's been my pleasure. You take care.
All right, thank you. You as well.